For this occupational therapy portfolio topic, we're going to be testing my patient's sensation using light touch, sharp and dull, vibration, proprioception, and kinesthesia. So the first one that we're going to do is we're going to test light touch. So I have this cotton ball here.
Okay.
Now to show you first what it's going to feel like, I can touch you on the face or I can touch you here at the neck. You let me know where you want me to touch you with the cotton ball to show you.
On my neck.
On your neck? Okay. Did you feel that?
Yep.
Yep. Okay. So, for example, for this video, we're going to be testing the sensation of the arms. And what's important to note with wherever you're testing is the dermatomes of where you're testing. So, for the arm, we have C6, C5, C6, C7, C8, and T1. So I'm going to have you place hands here, palms up, and what's going to happen is I'm going to touch you in different places on your arms with your eyes closed, and I'm going to, when you feel it, you can just give me a yes or some sort of indication that you felt it,
Okay.
and then I'll ask you where you felt it and whether it felt the same on both sides, okay?
Okay.
Alright, close your eyes when you're ready.
Yep. Ready. Yep. Yep.
Where'd you feel it?
On my upper arm, by my bicep.
Okay. Did it feel the same on both sides?
Yes. Yep. Yep.
Okay, where'd you feel it?
Here on my hand.
Okay, did it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
On my forearms.
Did it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
My middle fingers.
Did it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
On the sides of my upper arm.
Okay, did it feel the same on both sides?
Yep.
Okay, awesome. So that was testing sensation with light touch. Okay, now I'm going to be testing sensation using a sharper object than my cotton ball. So I'm going to be using this object that I got from this tool. And so as you can see, it's a sharper object. But again, I'm going to show you what it's going to feel like on your face or your neck. Where would you like me to touch you with it?
On my neck.
On your neck? Okay. So this is what it's going to feel like.
Okay.
Okay? So again, using the upper arms as example, again, I'm going to have you close your eyes. I'm going to touch you in different locations. You give me an indication of when you feel it. I ask you where you felt it, and if it felt the same on both sides, okay?
Okay.
Are you ready?
Yep.
Okay.
Go ahead. Yep. Yep.
Where'd you feel it?
Middle fingers.
Did it feel the same on both sides?
Yes.
Okay.
Yep. Yep.
Where'd you feel it?
On my bicep.
Did it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
On my forearm.
Did it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
Inner forearm.
Okay. Does it feel the same on both sides?
Yes. Yep. Yep.
Where'd you feel it?
The outside of my upper arms.
Did it feel the same on both sides?
Yes.
Fantastic. So again, this is testing our sensation with a sharp object. So this was for light touch. This is for sharp, or also testing for their sensation of pain. So now we're going to test my patient's sense of vibration using this tuning fork. So kind of similar to the other sensation testing, what I'm going to do is I will cause the tuning fork to vibrate. I'm going to show you what that feels like now.
Okay.
Can you feel that?
Yep.
Okay. So what I'm going to do for this is to show is I'm going to do it on the patient's MCP joint, styloid, elbow, and knee. So you're totally fine with the way you're sitting right here.
Okay.
And yeah, let me know when you feel it, and I'll ask if you felt it the same on both sides. Okay?
Okay.
All right. So go ahead and close your eyes.
Yep. Yep. Yep.
Feel the same on both sides?
Yes.
Okay.
Yep. Yep.
Feel the same on both sides?
Yes. Yep. Yep.
Feel the same on both sides?
Yep.
Okay.
Yep. Yep.
Feel the same on both sides?
Yes.
Awesome. Okay, so that was testing my patient's sense of vibration using a tuning fork. So now we're going to test my patient's sense of proprioception. For this example, we're going to use the upper limbs. So for example, let's say that our right arm is the involved limb. So when we're ready, I'm going to have you close your eyes. I'm going to place your arm in a certain position, and I'm going to ask you a couple questions about it, okay?
Okay.
All right, go ahead and close your eyes.
Okay.
Okay. Is your arm bent or straight?
Bent.
Is it facing up or down?
Down.
Okay, before you open your eyes, I'm going to have you take your uninvolved limb, your left arm, and I'm going to have you put it in the same position as your right arm.
Okay.
Fantastic. Okay, you can open your eyes and put your arms down. Okay, so for this, I'm wanting to make sure that with proprioception, my patient is able to identify where the involved limb is compared to their body. And when I'm placing the limb, I want to make sure that it's away from the body and not touching the body, because I don't want that to provide them a sense of where the arm is at. So they were able to identify my questions of whether the arm was bent or straight or up or down. So that was testing proprioception of the involved limb. Okay, now I'm going to be testing my patient's sense of kinesthesia. So what I'm going to do is I'm going to take their left arm and I'm going to have you close your eyes.
Okay.
And I'm going to place it in a position. And then with your eyes closed, I'm going to go ahead and have you with the right arm make that same position. Fantastic. Okay, you can open your eyes and put your arms down. So when I had them do it with both arms, what I was making sure was they were able to get the involved limb in the same position as the uninvolved limb within 15 degrees. And the point of this is to make sure that the kinesthesia isn't impaired and that they are able to identify where their arm is moving in space. So this is testing kinesthesia of the sensation for my patient.